Welcome to our video on hemophilia treatment. Hemophilia is a genetic disorder that affects the body's ability to properly clot blood. This can lead to prolonged bleeding, and in severe cases, joint damage, internal bleeding and other complications. But there is hope. By following these 3 simple treatments, those living with hemophilia can live a happy and healthy life. Hemophilia treatment option 1, replacement therapy. Replacement therapy involves infusing missing clotting factor into the body. This is typically done as an intravenous infusion, meaning the medication is delivered through a vein in the arm. The infusion can be done at a hospital or at home. Replacement therapy helps those with hemophilia produce more clotting factors, which can reduce the frequency and severity of bleeding episodes. Hemophilia treatment option 2, gene therapy. Gene therapy is a relatively new treatment option that can potentially cure hemophilia altogether. The treatment involves giving the patient a new copy of the gene that produces the missing clotting factor. This can be done through a viral vector, which is essentially a virus that has been modified to carry the new gene. After the virus infects cells in the body, the new gene instructs the cells to produce the missing clotting factor. Gene therapy remains in the experimental stage, but has shown promising results in clinical trials. Hemophilia treatment option 3, prophylaxis. Prophylaxis is a preventive treatment that involves regular infusion of clotting factor before bleeding episodes occur. This helps to maintain a stable level of clotting factor in the body and can significantly reduce the frequency of bleeding episodes. Prophylaxis is typically used for those with severe hemophilia, but may also be beneficial for those with moderate hemophilia. So there you have it, 3 simple hemophilia treatments that can make a world of difference. Hemophilia may be a serious condition, but with the right care and treatment, those who have it can live a long and fulfilling life. Don't forget to consult your doctor before making any changes to your medication regimen. Thank you for watching.